Just to introduce myself, my name's Nikki Rose. I'm a clinical psychologist. I've worked in the trust now for nearly 20 years, and I'm really passionate about staff health and well-being. So the purpose of today's session is to talk to you about mindfulness meditation. And I think one of the focuses of today is very much going to be on some of the evidence-based findings with regards to mindfulness meditation, because we often hear a lot about meditation, yet we very rarely get involved in taking it up and really understanding perhaps some of the benefits that a regular mindfulness meditation practice can offer. So as Sam explained, I'll be working through the presentation. All of this will be available post today. And once the presentation is finished, we'll stop the recording. And this gives us all an opportunity to ask any questions, have any reflections, basically whatever feels the most useful to yourselves. So very basically, what is mindfulness? And one of the most popular definitions we come across is that of Jon Kabat-Zinn. And Jon Kabat-Zinn is internationally renowned for the work that he has done on bringing mindfulness meditation to the mainstream. He works in Massachusetts and has run mindfulness meditation well-being programs for decades, and a lot of the evidence base has been developed as part of this program. He originally started his work in the hospital when other consultants were referring people to him, stating, "We just don't know what to do to help this person anymore." And so he simply describes mindfulness, need to go back one, Sam, as paying attention in a particular way, on purpose, in the present moment, non-judgmentally. And that sounds fairly straightforward, but as I'll explain, it's simple, but it's not easy. So I have crammed loads of evidence-based benefits of mindfulness onto the next few slides. I have got references for every claim I'm making, but again, for the benefit of a presentation, I haven't included them all, but they can be obtained from me after. But a few of the benefits found in research have been that mindfulness generally improves our physical health and our well-being in general. Mindfulness meditation can decrease stress. It can enhance our ability to cope and deal when we are unwell. It can facilitate our recovery. There is a growing body of evidence about the benefits of mindfulness meditation when people have experienced cancer and treatment for cancer. General physical health is improved by meditation. There is a decrease in depressive symptoms noticed. It can increase executive functioning. In service industry, it improves job performance. And office employees who participated in an 8-week mindfulness course actually experience lower levels of work stress, greater job satisfaction, and ultimately better job performance as rated by their employers. There's a whole host of additional benefits on the second page as well. Including decreased stress, psychological de-stress in both adults and employees, enhanced mental health, reduced incidences of problem drinking, enhanced academic achievement in students, improved connections with others and an improvement in our social and relational skills, a reduction of problem behaviours in children, reduces burnout in employees, it decreases turnover and turnover intentions at work, as I say, increases job performance and can build enhanced resilience. So just having a look at those 2 pages, it seems absolutely clear that we would all benefit in some way by undertaking a regular meditation practice. However, if it's this successful, why aren't we all doing it? And I pretty much think that this slide explains why, because we are absolutely bombarded all of the time with stimulation, with pulls, with things that seem shiny and exciting. And it really takes quite a considerable effort to choose to come into the present moment. And, you know, we talk about being alone with our thoughts and just being. And I imagine for most of us, it wouldn't seem that difficult or terrifying a prospect. I mean, I'm guessing it may well do, but I just wanted to present these findings from a research trial that was published in the Science magazine. And Wilson et al. Reviewed 11 studies. These studies were very much focused on seeing how people manage with being alone with their thoughts. They were asked to put away any distractions and entertain themselves, basically sit with themselves for a range of periods, some 6 minutes up to 15 minutes. So when these studies were reviewed, it was found that in the first 6 of these studies, over half of the participants rated the difficulty at or above the midpoint scale. So over half of the participants said this was somewhat quite difficult to do, you know, to just sit and be. And 42% of these individuals reported that it really just wasn't very enjoyable. So again, quite a surprise there that people just cannot enjoy or sit at ease with themselves for up to 15 minutes. But the additional findings were even more startling, really. So in the 7th study, the participants were asked to complete this task at home, so not having somebody observing them, and over 30% of individuals admitted to cheating, and these are the individuals that actually admitted to it. So we might find that if we had managed to record what people were doing unbeknown to them, it may well have been higher. But 32% of people could not complete the task and had to use their phone, listen to music, do just about anything other than sit there. And more surprising still, in the lab studies, data ended up having to be excluded because one participant used the pen that had accidentally been left in the room to write a to-do list. The other participant used the instruction sheet and started to practice origami. So again, this ability to just sit there was too much, and people had to find a way to distract themselves. In another one of the study, participants were actually wired up to and could shock themselves during the period if they desired. And prior to the opportunity to sit there, quite a few people said they would pay money not to feel the shock again. However, rather than be with their own thoughts, a quarter of the women and 2/3 of the men actually chose to give themselves an electric shock rather than be with their own thoughts, which, you know, is pretty, well, I found that really pretty shocking, excuse the pun. So more evidence really of how difficult just being with ourselves is in today's society. I found this article a couple of weeks ago about Mark Zuckerberg. Now, Mark Zuckerberg is the founder of Facebook. He is the world's youngest billionaire. You know, this individual has got literally anything he wants at his fingertips. And he has announced that he has had to give up his daily running as exercise because the problem with running is that you can think a lot. So he's now trying to get an exercise that is both super engaging physically, but also intellectually, because he needs that level of stimulation. Otherwise, he's going to end up thinking, and that seems too difficult to do. So when you consider that at the lowest estimates, he is earning about £2.5 billion a year, it really impacted on me to hear that somebody with that amount of money and power is so troubled by his own mind that he cannot do activities he enjoys because of the risk of being alone with his thoughts. And I think that goes, you know, an incredible way to demonstrate that if we can't be with ourselves, absolutely nothing that our external world can provide us with is going to be enough, because there is nothing Mark Zuckerberg couldn't actually afford and have access to, and still he is struggling. And I thought that was worth including. So I think this really is a helpful way for us to think about what mindfulness is, and again, how the practice of mindfulness can have all of these benefits that can't be purchased. And that there is quite a view that mindfulness is, oh, it's just sitting, it's just relaxing. But when we start to think more about the science of mindfulness, we appreciate that these techniques are not just mood management or relaxation. They're actually a form of mental training, and being able to train ourselves to notice where our mind has wandered and then decide where to refocus it can actually help us reduce cognitive vulnerability to more reactive modes of the mind that can lead to emotional distress. So, you know, if we're being pulled to something that we're finding distressing, if we have practiced mindfulness to the extent we're able to choose to bring our mind to something else, we start to get an idea of why that is so beneficial. So I just want to talk a little bit about what I mean by mindfulness in terms of mindfulness-based approaches. Now, mindfulness meditation, and certainly meditation, has been around for thousands of years. I'm very much today focusing on the evidence-based practice of mindfulness that tends to be done in medical and self care settings. So we have that, you know, a few very well recognized and well researched mindfulness approaches. So we have mindfulness-based stress reduction, and this was the program devised by John Kabat-Zinn and rolled out to tens of thousands of people now. And this is very much about enabling people to practice meditation over generally 8 to 12 weeks to bring down their experience of stress and distress. And as this is done in a hospital setting, this is usually for people who have experienced a lot of pain. And as I said previously, there hasn't been any medical explanation for the pain. And so the mindfulness-based stress reduction is to try and help people perhaps live with pain we don't understand how to treat. Then Mark Williams and co. developed the mindfulness-based cognitive therapy program, again another 8-week program, and this specifically was developed to work with individuals who had experienced recurrent episodes of significant depression. And as I will go on to explain, that there is quite a large evidence base that makes this approach comparable with prescription drugs for depression. Dialectical behaviour therapy was devised by Marsha Linehan, and that again is a behavioural approach very much with mindfulness meditation at the heart of what's delivered, to help people really start to notice where their pulls are, what they're trying to avoid, and how to make sense of that. More recently, we have ACT, Acceptance and Commitment Therapy, the work of Steve Hayes, and this includes a large amount of mindfulness meditation with a strong focus on our value base and how we want to move forward in life. And then we have compassion focused therapy devised by Paul Gilbert, and this is very, very much about again using meditation to increase our awareness of how we view ourselves. And you know, it still surprises me that it's taken this many years really for mindfulness therapies to reach mainstream, particularly when you know, I reminded myself that when Stephen Hayes released Get Out of Your Mind and Into Your Life in 2005, which is the acceptance and commitment therapy bestseller, that actually outsold Harry Potter that month on Amazon, you know, which was at the time a real achievement, not only demonstrating the appetite for self-help books, but also, you know, how long these approaches have been around for. And what that certainly has done is allow researchers to start to get a real understanding of some of the processes and the evidence base for these models. So it's not just relaxation, it's not a mood management technique, it's bringing this attitude of noticing and awareness. So some of the actual components that make mindfulness meditation so beneficial is that it's this ability to develop conscious control of our attention. So as I was saying earlier, if we notice where our mind goes, we have the ability to bring it back to somewhere more beneficial. And if we notice that our mind is going places that are difficult, yet we're able to observe this and do so with an attitude of acceptance, that provides some understanding as to why mindfulness meditation can increase compassion towards oneself. If we are increasingly accepting of what is happening in the moment and trying not to judge our own actions within that, then it makes sense that it's the kinder approach. You know, a lot of people have gone on to expand on some of the components, such as including awareness, attitude, and flexibility, very much highlighting that mindfulness, it's not a thinking process. It's an awareness process. So we are very much trying to take an observer stance during mindfulness, as opposed to being really caught up in our thoughts. And this is why this is quite an unusual way to talk about mindfulness in terms of the science of mindfulness, because previously when I've delivered mindfulness workshops, I've insisted that it's very experiential. However, you know, I think that having the context and the understanding of why it works for so many people and how it works is more likely to lead to people wanting to give it a try. So I'm hoping by covering some of this, that makes it more accessible. So you know, it's about having this attitude of openness and curiosity. You know, like every other therapy, mindfulness is not going to work if we go into it thinking, well, this isn't going to work. You know, we need to have a commitment to wanting to do the work, to practice, to be curious. And unfortunately, you know, an integral part of life is experiencing difficult, painful, and unpleasant things. And if we can learn to be able to accept them and manage them as they come rather than running from them, we're better able to tolerate them. And this ability to focus attention on different aspects of our experience really allows us to choose to some degree how much suffering we're going to experience as a result of some of these painful experiences we have. So I'm going to run through some of the key findings with regards to the actual benefits. I mean, these are primarily half-an-hour sessions, so it's really hard to get a huge degree of depth, but I'm always available to be bombarded with questions and challenges, whatever comes up later. So certainly the APA now has done hundreds of mindfulness studies. In fact, if you Google mindfulness-based evidence studies, there are tens of thousands, but certainly now there is the recognition that mindfulness-based therapy is particularly effective in reducing stress, anxiety, and depression. And with regards to depressive symptoms, not only has mindfulness meditation been shown to reduce depression, it's also been shown to prevent relapse of depression. And that is at least as effectively as antidepressant medication. You know, and I certainly wouldn't advocate that anyone stops taking any medication that they're on without, you know, speaking to a GP. But certainly we know that any medications come with some risk of side effects. So knowing that there is something out there that is a viable alternative, I think is really heartening. And several studies have also shown that not only can it prevent relapse, but it can significantly reduce the relapse as well. So maybe stop people from having periods of major depression to the same extent as they previously had. The most recent study that I had a look at last week when thinking about the claims that science is making with regards to mindfulness-based meditation, I mean, it would have been quicker to find things that people were claiming it couldn't benefit, but certainly there is a lot out there to say it can improve physical health, certainly with regards to pain, fatigue, and levels of stress in individuals who are experiencing chronic pain. There are also other studies that are stating that mindfulness may boost the immune system and help people recover more quickly from the cold or flu, and as I said, there's increasing research there with regards to people who have experienced immune system deficits as a result of chemo and radiotherapy. So as well as physical benefits, increased emotional regulation is another benefit of meditation. So This is our ability really to exert our control over our own emotions based on a situation. And not surprisingly, our emotional regulation has a really important role in our mental well-being, particularly as difficulties in this area are linked to a number of psychiatric conditions. So it's been shown that actually via neuroimaging that mindfulness training alters the brain, and the area of the brain that is activated and deactivated in response to emotion inducing stimuli, and specifically DBT, dialectical behaviour therapy, has found to be effective in helping people manage their emotions, even in individuals with PTSD, for example, which, you know, any trauma can be particularly challenging to treat. So not only have we got evidence for improved physical and mental well-being, also in terms of our cognitive functioning as well. So this study by Greenberg et al. Shows that people who received just 4 weeks of mindfulness training actually showed improvements that were demonstrated in their brain with regards to increased short-term memory. So the actual volume changes occurred in the hippocampus, which is the area of the brain associated with memory. And in addition, there are other improved areas of cognitive ability. So Zhao et al. in 2020 found that mindfulness actually can help us improve our ability to focus attention over time. It can improve our ability to shift thoughts and our attention in spite of distractions around us. And it allows us to be able to suppress thoughts that might be intrusive and interfering with our current focus. So again, you know, looking at how mindfulness not only can benefit at home and at work, there is so much evidence now and use of mindfulness-based strategies in a lot of large private sector industries, because they are finding that mindful individuals have got good memories, can focus, are task orientated and highly productive. But again, it's, you know, not just in this cognitive ability, it is this improved physical health. So there are certainly a number of conditions such as lower back pain without an obvious cause, rheumatoid arthritis, psoriasis, type 2 diabetes, fibromyalgia, all of these you know, autoimmune system conditions have been shown to have improvements if people are regularly practicing mindfulness-based meditations. And I just wanted to quickly run through some of the different types of techniques, just because the whole plethora of terminology can be difficult. So when we talk about mindfulness meditation, we tend to be very much talking about a single focus meditation. So, you know, one where you may quietly sit and notice your breathing, or focus on a candle flame, for example, or silently repeat a mantra. Some of the other mindfulness techniques tend to focus around bodily sensations. So anyone who's ever undertaken a body scan meditation or a yoga nidra will be very familiar with this. And this is where you're invited to notice perhaps an itch or tingling, or, you know, any sensation in the body, and just noticing and letting it be. And then sensory meditations. So again, this might be about noticing sights, sounds, smells, tastes, touches. And then usually at a time when we've got more comfortable with the other techniques, we might start to think about the mindfulness of emotion. So allowing our emotions to be present without judgment, and accepting the presence of the emotion and allowing them to dissipate. And urge surfing is particularly helpful form of mindfulness meditation that helps us cope with cravings. And this is just about, again, noticing how your body feels in response to a particular craving, and attempting to just accept the craving and replace that wish with the knowledge that it is transient, that will pass. So that is a huge amount of information about thousands of studies condensed into a real sort of bite-size science of meditation presentation. It is worth acknowledging that you know, this is an investment in yourself. If you only believe a quarter of the benefits of mindfulness that I presented at the front of the PowerPoint, that is a huge amount of potential benefits to your health and well-being. But the effects of mindfulness are dose related, and by this we mean the higher the dose, the more benefit it has. I tend to compare mindfulness meditation with physical exercise, in that if you want your body to be in peak performance, you will go to the gym 5 out of 7 days a week, or take some sort of regular exercise, and you would expect to have to put that work in to get that real benefit to your physical well-being. And that's very much the same for our mental, our cognitive ability with mindfulness meditation. You know, if we really want to feel the benefits of what mindfulness meditation has to offer, then we need to make a commitment to do it. So most people tend to find that it takes a good 20 minutes for the mind to begin to settle. And by that, I don't mean completely clear, I just mean settle. And so that would be a, you know, somewhere to aim towards. If you're really committed, if you're really ready for a serious commitment, Jon Kabat-Zinn actually recommends 45 minutes of meditation at least 6 days a week. And he does talk a lot about that, you needing to get to the point where you're really bored, because only then can we start to just relax into and accept what's around us. And it's really worth remembering that the idea of simply sitting there, it's quite simple, but it's really not easy. So always go into any practice remembering non-judgment. Now, there are a whole host of online resources. I mean, this is just a tiny amount of what's out there. Certainly I know that a lot of us through our organisations may have access to apps as well, like Calm and Headspace, so it's worth checking in and finding out more about those. I've also included a number of books that are really helpful for a whole host of different opinions and ways and practices for mindfulness. But we will draw the presentation part to a close now.